Traumatic accidents such as falling from a height, getting thrown from a vehicle, or sustaining a blow to the head can cause head, neck, and spinal injuries. Signs and symptoms that might cause you to suspect a head, neck, or spinal injury include mechanism of injury, which means the method by which the injury occurred, a change in behavior or mental status, for example, unresponsiveness, confusion, stumbling, repeatedly asking the same questions, memory loss, nausea or vomiting, or speech problems, head, neck, or back pain or visible injury, a partial or complete loss of sensation or movement in part of the body, seizures, and the inability to do activities that the person could previously do, such as walking. After completing your check and call steps, provide care for the person with a head, neck, or spinal injury according to your level of training. While you're waiting for EMS personnel to arrive, have the person remain in the position in which they were found, unless you need to move them to give CPR or control bleeding. Also, help maintain the person's body temperature, and, based on your level of training, care for any other injuries that may be present. A concussion is a traumatic brain injury that alters the way the brain functions. Concussions can occur anytime a person experiences a bump, blow, or jolt that results in rapid movement of the brain within the head. Signs and symptoms of a concussion include dizziness, loss of consciousness, headache, confusion, blurred and/or double vision, nausea, vomiting, seizures, memory loss, and the inability to do activities that the person could previously do. As always, complete your check step. If you think a person has a concussion, advise them to stop their activity. If you see signs and symptoms of concussion in a person, call 911 and get the equipment or tell someone to do so. Then give care for a person with a concussion according to your level of training. First aid care for concussion is the same as for all types of injuries to the body. While you are waiting for EMS personnel to arrive, have the person rest without moving. Help maintain their body temperature and, based on your level of training, care for any other injuries that may be present. If, for any reason, EMS was not called, the person should follow up with a healthcare provider as soon as possible for a full evaluation.